Welcome to the office.
Hi.
Hi.
Welcome to the office.
Thank you.
How can I help you?
Well, I've been feeling some knee pain, and I work remotely, and I have been for at least 3 years, and I can feel kind of stiffness in my body. I just started going to the gym again. I grew up playing soccer, and even when I move my leg, it starts cracking, it just nonstop.
Let's
cracking.
rewind for just a second.
Yeah.
So you're local. You live in LA.
Yes.
Right now.
Right
Okay.
now. Well, I'm not local, but
close enough.
Yeah.
And how did you find us?
Online.
Online.
Yeah.
Okay.
So I started watching videos,
Okay.
and honestly, I've been wanting to get adjusted for over 3 years. I'm like one of those doomsday scrollers on watching adjustments.
Have you been adjusted before?
No, I have not.
Oh, so hold on. So for the last 3 years, watching videos, you've been wanting to get adjusted.
Yeah, but I have a fear. I know that's a dangerous. It's not. I mean, no, I wouldn't say dangerous, but it's not for. You have to be careful on who you go to, and so I've been watching, but I've been fearful of who to go to.
You have to be careful. Why?
I mean, if you get badly adjusted, I'm sure it's not going to be good on the body. So.
Yes, there's truth to that. Now listen, I want to just address that because it's kind of important.
Yeah.
And there are a lot of great chiropractors out there. I do the method called Gonstead Chiropractic. There are a lot of great Gonstead chiropractors out there. There are a lot of great non-Gonstead chiropractors out there. There are a lot of great adjusters out there. And with me, the idea is, what's the intention?
Yeah.
And I'm just going to say this out there, and I've said it in the past many times. Why do we have chiropractors on the planet? To detect and correct the vertebral subluxation or the nerve pressure, where the bone is misaligned, creating some sort of irritation and inflammation at that joint. It gets stuck, it degenerates. Wherever those nerves go, there's less function. Okay. Now, I'm of the school of mechanics, that we want to always follow joint mechanics. And so in this work, we don't do rotational twisting. It may seem like you're rolling, but we're not twisting the spine, and that's very important. There are a lot of people out there who have bad experiences. Okay, they had a bad experience with a chiropractor, and so they completely gave up on it, and that's it. I'll never go back to a chiro again. Well, if we want to use that logic, Jessica, then let's say you had a bad experience at the dentist. You stop going?
Absolutely
You're done?
not. Yeah, no.
Why? Why?
Which I did.
No, but why? So if you had a bad experience at a dentist, do you stop going to all dentists?
Now you just look for a new one.
You find the one that works for you, right? But why? Why is it so important to go to the dentist?
I'm not trying to have my teeth rotting. I know it's
So-
important to go to your checkups. So.
Checkups.
Yeah.
So you go to get checked to make sure you have no
Cavities or whatever.
Correct.
Problems.
Correct. Yeah. Now, if you see a cavity, it's probably been there a long time, right?
I would assume so, yeah.
Okay. But you can also have a cavity that you don't see.
I think so, yeah.
Okay. So same thing in the spine. Isn't the spine kind of important?
For sure.
All right.
It's like the core of everything.
It's everything.
Yeah.
And so it's just as important to get your spine checked.
Yeah.
And that's what I encourage a lot, is get your spine checked to see, do you have nerve interference? Are you clear?
Yeah.
If you're clear, then you're not my case. You get what I'm saying? It's find the pressure, get checked. If there's pressure, yes, correct it. Don't just randomly manipulate the spine just to make sounds.
Yeah.
Make sense?
Yeah.
I can't even
And you're
do
probably
this.
not going to like this, but I've been cracking my own neck for years now. And
I see.
It's a bad habit. Yeah.
Okay, I see.
It's a bad habit, but sometimes I can't, I feel like I don't have full mobility if I don't do that.
Now,
And
when you
so-
say you crack, you're forcing it or
No,
just...
I'm just I mean, I could do it now if you want me to.
Do it. Okay. Now, that's still better than taking your arm...
Oh, no, I would never.
So that's still better, okay?
Yeah, no.
I don't like it, but it's
it's a
still
release
better.
for me,
Yes,
you know?
but it's better. And I'll explain
Yeah.
why that's a release on your X-ray, why that's happening, okay?
Yeah.
Because part of it is getting the answers. So going back to your question, and a mentor taught me this, you know, Rahim, it's better to not get an adjustment than to get a bad adjustment.
Yeah.
And it's kind of a brutal statement, you know, and like I said, it's not specifically, there are many methods and ways to find joint dysfunction causing some sort of nerve irritation or neurological compromise. And there are many ways to adjust specifically following the mechanics. It's not just you have to be a Gonstead chiropractor. And the reason I say that is just saying there's a lot of great guys out there. It's finding the right chiropractor for you.
That makes sense.
Yeah? Okay. All right, now let's get into your case.
All right.
Why are you here?
The good stuff.
Yeah. Talk to me.
Well, I sit.
So your motivating factor was your knee?
No.
So what motivated
Honestly,
you?
one, I've been watching so many videos that I just know it's good to kind of get the release, and especially me that I'm sitting all day. I know I'm probably I mean, I don't know the terminology, but I can feel just the stiffness in my body.
Okay.
Again, like knee pain, and then I can just feel my hips tight. Like I've had some lower back pain again from all the sitting.
Okay.
And so I'm like, okay, and now is the time.
It's
and so
time.
I started doing research, and luckily found you.
Okay. What else? So back, knee,
and just wellness, really. I mean, I know there's importance to it, and I've just kind of I'm a procrastinator, so I've been delaying it.
Okay.
And then I think all these accumulated things just kind of pushed me to finally get it. Yeah.
It's catching up now.
Yeah, exactly.
Okay. All right. So this is then more of I have aches and pains. I have imbalances.
Yeah.
We'll go over your X-ray then. Let me explain everything that I see. What's ideal, what you have, and then we'll do the exam, figure out where we'll start. Is it just spine? Do we have any ankle issues, shoulder, TMJ?
I mean, I just
septum, breathing?
I honestly feel like, I mean, I was on the treadmill this morning on the gym, and I just feel like because I've been out of the gym now for about 3 years, I feel like it's just I need to maybe exercise them and gain strength, both the knee and the ankle. So again, that's my assumption. I don't know if that's fact. Bless you. I don't know if that's fact, but that's just my assumption.
So there's part of it. So we'll look at getting the power on, getting the alignment right.
I didn't realize there was sinus stuff going on.
There's some stuff. Come here, let me show you.
Yeah, and then the jaw, like, I mean, when I was younger, and I don't know if it's related to braces or whatever, but like it doesn't happen anymore, but when I would open my mouth, it would crack.
Okay, so what do we see here? We have a rotated sacrum on the side of a rotated pelvis. Now, there's a slightly shorter leg on the left side. We have a 1 millimeter measured difference. What's tripping me out, it looks more than 1. I don't know why it's showing up as 1, but I guess it is. Okay. Now, in order to have a stable building, we need this to be balanced. So what's going on here? Let me explain the right side first. The tailbone on the right side, the sacrum, goes back 3 millimeters. The pelvis on the right side goes up and out. That's the disconnect on the right SI joint. That's number one. Number two, we're looking at the spine here, and we can see that it's kind of going to this right side, correct?
Yeah.
And it's veering to the right. Then what does it do? It wants to come back to the left. Comes back to neutral, then what does it want to do? It's straight through, and then we have misalignment of the jaw. We have misalignment of the septum. We can see a clear airway on the left side, but not the right side. So if that's something you want
Would
me
that
to...
explain my snoring? Because I didn't grow up snoring, and I apparently now I do.
You got hit in the nose? Some trauma, injury, sport, fight?
Could have been. I mean, my brother grew up, you know.
All right. I get it.
Siblings.
I get it. So that's the first imbalance is we need to look at your tailbone, okay? This is number one. That's where we're starting. When we're looking up top here, overall, all of this is compensation up until somewhere in here, because all of this is tilting slightly to that left side. Then it straightens out, and then it tilts again at T2. So whatever's going on here, we'll examine you, but nothing is really popping out at me straight off the bat on that X-ray. We're going to get more answers on this X-ray. Okay. Now, on this X-ray, we're looking at three main things. We're looking at curvature in the spine, we're looking at posture, and we're looking at disc spaces. So the first question is, curvature. When we look at the curve in your spine, I would like to see a little more curve in the low back, and then what happens in the mid, it's straight. And then in the neck, there's a reversal. This needs to go forward 40 to 60, 60, and 60. The posture is the second issue. And this is going to explain your shoulder and neck stuff. So when we're running a posture line, that line should go from the lowest lumbar through the base of the neck here and the top. So what it's showing us, if this is the upper part of the building, this is the lower, the upper part is behind the foundation. So all these muscles are working tight over time.
I do have terrible posture. I do know that.
And so you get tight and stiff, right? When you're sitting or standing a long time. So we need to figure out how we're going to bring that forward for you, okay? And there is good news here at the end. I will explain. All of this started, there's a few tailbone injuries. I want you to see what I'm showing you. This is the sacrum. It should be a smooth curve. We got one nub there, one there, but more important, you have an anterior coccyx right there.
Oh, I've seen that one in your videos.
Look, we got to bring that out.
Yeah.
That's the fun one.
Yeah.
No pun.
Yeah, I know.
All right. So we have a coccyx, we have a rotated sacrum. Now, I said 15 years because I was talking about this L5. Look at that L5. That's a beautiful disc. These are great discs. But your L5 is tilted back quite significantly and tilted.
That would explain my lower back.
Yes,
pain.
ma'am.
Yeah.
Yes, ma'am. Now, as we go up, these discs are all good, okay? These discs are good. These discs are good. As we go up the spine, thoracic, these discs are good. These are good. These discs are fine. But when we get to the neck, what happened? You can see there was an old whiplash here. 2, 3, 4, 5, 6, 7. Shape of that disc is about 15 to 18 years ago, whatever happened, yes. So your low back, your neck were old injuries. Whatever happened more recently was a trigger of a process that was already happening. So the reverse curve in the neck, we're going to work on by working on the base of the neck. I will give you postural habit changes that you need to start working on. You're still young enough to make these changes, otherwise all of this does what? It stays in that position. Muscles, ligaments, everything adapts over time. That's your stiffness, that's your tightness. Okay? Does that make sense?
Yeah.
All right. Now, your digestion is also off, ma'am. When I'm looking at digestion, I'm looking at this. I'm looking at what we call the Meganblase here. There should be a big black half circle. You have just a small one there. This is all undigested food producing gas, fermenting, so you're not absorbing, assimilating. The control of that starts in the middle here, but there's also what I see, there's a potential HCl need. And I'll probably recommend you taking an HCl supplement with your meals. It's natural, it mixes with your food.
Is it vegan?
We have a vegan one.
Okay, cool.
Yeah, we have a vegan one. And it activates the enzymes of digestion. Okay, activates your own enzymes to break down the foods. Okay. The other thing I want you to know, there's a finding that I see if you go back to my old videos, long format. I see flailing of the ribs. You're getting calcification of the costochondral junctions. Whenever I see that, 8 times, 9 times out of 10, there's an underlying thyroid issue. So I'm going to recommend getting thyroid checked, okay? This is an important finding I learned many, many years ago by one of my chiros. And it's better to just rule it out, okay? Which could it relate to energy, low energy, trouble, getting moving, metabolizing foods, weight gain, switching back and forth, hair changes. Okay?
I've been having all of that.
All right, so I think it's something.
Or a lot of it, at least.
I think you should get that checked, okay? And I'm happy to work with you naturally with that if you choose, whatever you want to do with that, okay? If that shows up. Make sense?
Now, you said the thyroid check. I guess when you say naturally, can you elaborate?
I balance it naturally. I'm a functional medicine doctor.
Okay. Yeah, because I avoid doctors like the plague unless I'm dying.
All right, you ready?
Born ready.
Let's do this.
At least I say that now.
All right, well,
Wow, this is a lot more than I guess I was anticipating before. I mean, I was just thinking it was like, especially this, like.
But your hip is coming from there. I showed you.
And I can feel that one, and so I thought it was just that.
Let me explain your hip, because the way your hip is misaligned, it's a trauma. It's not posture. The SI joint is called a auricular surface. Is the shape of it. It has tongue and grooves in there, and it moves in very specific manner. When it goes AS, up, it naturally wants to go in, IN. I'm referencing the PSIS, this bump to the lateral sacrum. When it goes down, it wants to come out. Yours is up and out. That's a trauma. So what's happened is this. Your hip sits in there, right?
Yep.
If this thing is gone, let's say it's here, it's gone up. It's gone up and out. This way.
Yeah.
What does it do to the angle? It throws the angle off. So the pulley is off, so guess what happens to those cables? They keep hitting.
Yeah.
That's what you're hearing.
That makes a lot more sense.
All right. Yeah. You ready to get started?
Yep.
Showtime. Walk to the corner of the room and back a few times. And just back and forth several times, please. So just from your walk, keep walking, I'm just talking. As she's walking, first thing you can see is that right foot flares a little bit. Just keep walking. Keep going. And I don't see smooth motion going through your dimples, the SI joints. It's a little bit choppy. So when you're walking, you're a little guarded in your walk.
Yeah.
That left side doesn't want to move up and down.
I've been feeling misaligned for a while.
Yeah, keep going. Yeah, so we want to get better movement through her SI joints. Come have a seat, please. And let's run the meter on the back. Let's see what we got. Head down, please, starting at the base of the neck. Look up a tiny bit. And the first thing we got is C7, 5 points. Left side, C1, right side. Ten points, T6, T7, that's the digestion area. Nice, there it is. All right, we're going down low. There it is. 7 points, S4, S5. We'll check more with palpation. Let's check up top. 10 points, C1, C7, T6, 7, S4, 5, and we're going to check on the coccyx. Now let's do static palpation, head down. Static palpation, running my fingers down the spine. Looking for swelling, edema, and point tenderness. You can see right there, it starts the edema. It pulls right there, orange peely, and then it passes. 1, 2, 3, 4, 5, 6. Tender. 7 more or 6 more?
That one.
6. Head down, please. Good. Right there. 7. 7, 7 in sacrum. Okay, let's check down low. Come back slowly towards me, back in extension. This is 5. This is 1. That's not bad. 2. Yes. 3. 4. Yes.
Shit.
5. Yes.
More, the other one hurt a little more.
4.
Yeah, that one.
4.
Yeah.
Relax the back. Come back slowly. 5. 1. 2. 3. That's the one. 4.
Yep, that one.
I'm going to be on the outside down low, ma'am. That's the coccyx. Coccyx, S4, T7, C7. All right, let's get a game plan going. You didn't expect that, did you?
No, I did not.
Okay, so here's what we'll do. We got to do anterior coccyx. So the way we're gonna start it on the side. I'm going to bring it out a little bit on the side, then we're going to go face down there, do more of the coccyx, do T7, have you walk, go back and do sacrum, have you walk, and then do the neck and tune up the rest.
Okay.
You ready?
Yep.
Right side down. Showtime!
You said what?
I'm on the outside. I got to bring it out. Out. There. And
oh,
that's the home run.
Ooh.
Hi.
Okay.
That's the home run. Come on up. Walk it out. Check it out.
Oh yeah, that feels a lot looser. Yeah.
Face down. It's funny, a lot of people don't think the coccyx adjustment is a real thing.
Oh wow. Yeah.
It changes the whole game, right? Changes the whole structure,
Like
changes the
sound?
tone. You're going to put your hands here, please. Face down. 1, 2, 3, 4, 5, 6, 7. Easy peasy. Relax the shoulders, please. Good. Perfect. Gotcha. 1, 2, 3. We're going to be slightly on the right side. We want to torque up. Slide up a tiny bit, please. Keep going. Go, 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 go. There you go. I'll use the drop with a little torque on the right. That's a little bit. Hi. That's the home run. Gotcha. Let's bring you up. Walk it out. Check it out.
It's crazy how much better I feel just walking.
What's different? Let's open the back so we can see the hips. Let's see if the hips are moving better.
I felt like awkward even when I walked, like I could feel misaligned. It's weird.
Now?
I mean, I feel a lot better.
Well, your hips are moving a little bit more.
Yeah.
It's good. One more time. Have a seat. Pretty cool, huh?
Yep.
E.
Sweet.
All the way back. C7, left side. Hands on your lap. There. No, you are a self-cracker. Punk. Clonk. Nice.
Ooh. I'm sure I
Yes.
didn't get that one before. Oh. Just cracked my ear?
I just got your ears, lady. Sit straight and breathe. You see how you're sitting right now?
Yeah.
Let's recheck on the meter. Good stuff. Starting at the base. 7 is clear. That cleared up top. Mid-back is clear. But most important is what we had to do down low.
That one felt really good.
All clear. Check this out. Come back slowly. 5.
Oh, wow.
Check it out. Limbo time. 1.
Oh, wow.
Check it out. 2.
And it doesn't hurt.
3. 2. 3.
That one still stings a little bit.
This is the one that you were screaming about. 4.
I feel it a little bit, but nowhere near.
Correct.
Yeah.
Awesome. May I continue?
Yep.
On your back here, please. Let's work on the ankles. So the moral of the story, adjust only what needs to be adjusted. Sit up and turn. Shoulders, I'm reaching over. Let me do it. Let me do it, please. There you go. Now, nose in, jaw.
Oh, man. That's the one I'm real nervous about.
What's that?
The jaw. That's the one that has me a lot more nervous, to be fair.
You want me to leave it?
No, no.
Sit back.
take care of it.
And then get over it. Ha! Slowly open, 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 right side. Open all the way, open. Right AI, close, open, slowly close, slow. There you go. Gotcha. Let's go on your back here and work on your nose. Good times. Slide down a little bit. So we said the blockage was on the right side. Chin down. Oh yeah. Breathe through the mouth. There you go. Now the right maxillary bone holding the left side, pushing on the right. There you go. Breathe in. Come on up, walk off that nose job. Walk it off.
I do feel a lot looser just walking in general. Thank you.
Keep walking one more time. And then I'll give you some homework, okay?
Alrighty.
Simple walking, 10,000 steps a day, no gym right now.
No gym?
Not right. Body weight is fine, just for the week.
What do you mean by body weight?
Pull-ups, push-ups, planks are okay.
Okay.
You can do body weight and cardio all day long.
Okay. Okay.
Yeah, just no free weights right now.
For how long?
And the week. Let's get through the week, okay?
Okay.
Neck is clear, mid-back is clear, just making sure nothing came out. All clear. Now is a buff and polish. Vibration therapy. I have a lot of post-surgical cases. I have a lot of paralysis cases. And again, doesn't matter who you are, what you have. Everybody got a spine, everyone got a nervous system. Right?
Yep.
Stand up, please. Squeeze. When there is interference between brain and body, body can't function at its best. You're doing great.
Ooh.
Nice.
Oh, I needed that one.
Squeeze. Relax. Oh. Nice. Squeeze. Good. Squeeze. Questions for today?
No, I actually, this thumb was really bothering me and I feel like I really needed
Cool.
side comment, no.
You understand what I explained?
Yes.
Okay, I know you'll have questions in the future, no problem.
Yeah.
I'll see you a couple of visits and we'll figure out where to go from there.
Awesome, thank
Welcome
you so
to
much.
the office.
Yeah, thank you.
got it.
Appreciate it.